Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Deena Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we'll open the floor to questions.
Thank you, Tom, and good afternoon, everyone. We've now administered more than 101,000 doses of vaccine in Alberta, and there are now more than 11,000 Albertans who have been fully immunized with 2 doses. Over the last 24 hours, we have identified 459 new cases of COVID-19 and completed more than 12,800 tests. Our positivity rate currently stands at about 3.6%. There are currently active alerts in 273 schools and outbreaks in 15. This is about 12% of schools in the province. Currently, these schools have a combined total of 554 cases. Sadly, I must announce that 12 new deaths were reported to Alberta Health in the last 24 hours. My thoughts are with the family and friends grieving each of these individuals. Each death is a reminder that we must continue to take action to prevent the spread of this virus. Despite the decline in new and active cases across the province, there is still a lot of pressure on our healthcare system. Today, I want to explain why we are focusing on protecting this system and why high hospitalization numbers affect all of us. Thanks to the hard work and sacrifices of so many Albertans, we have seen hospitalizations decline significantly over the past few weeks. From the peak of 943 people in hospital on December 30th, we have declined to 604 today. From a high of 155 ICU admissions, we are now down to 110. This is encouraging news and a signal that we are making meaningful progress. Every one of us should take pride in this. However, it also means that there are just as many people in hospital today as there were on December 4th, when our acute care system was struggling under the impact of COVID-19. While hospitalizations are declining, the health system is still feeling this strain today, which impacts anyone who needs care, regardless of whether it is because of COVID or any other reason. For example, let's consider someone who has a heart attack or someone who falls and breaks their wrist. Both of these require hospital care and have nothing to do with COVID-19. In both cases, the large number of COVID beds that are currently occupied with patients and the precautions that must be taken to prevent the spread of the virus in hospital mean there are fewer beds available when patients arrive. When we have a high number of COVID-19 patients requiring care, this means that hospital units fill up faster, and there are fewer spaces available for those who suffer strokes, heart attacks, or other ailments. If we're not careful, people who need to be admitted to hospital can then spend longer in the emergency department while waiting for a bed. This, in turn, can lead emergency departments to fill up faster, challenging their ability to take new arrivals, leaving Albertans with broken bones and other less severe needs in waiting rooms. These are only 2 examples. The high numbers of hospitalizations also impacts all patients in other ways, from reducing the number of doctors or nurses available for frontline care to forcing us to postpone some non-urgent scheduled surgeries to free up capacity. Thankfully, Alberta Health Services and Covenant Health have done an incredible job over this past year of ensuring that care is available for people who need it throughout this pandemic. No one should ignore symptoms of cancer, stroke, heart disease, or other important conditions. Everyone should know that if they are in need of urgent care, that care is available. To keep it that way, it is essential that we keep the restrictions in place for a little while longer so we can ensure care is readily available for all Albertans across the province, whatever their health needs are. I know these measures are profoundly impacting many people, and I understand the desire of some to move forward now and hope that things turn out okay. We are monitoring the situation in the province and hope to update Albertans soon on when some of the current restrictions may be safely eased. Until then, it is essential that we all continue to follow the measures in place. This is how we protect our health system and each other. Thank you, and I'm happy to take questions.
All right, we have a very full queue, but we will try to get through as many as possible. Operator, could you put through the first caller, please?
Thank you. The first question is from Jeff Slack, 660 News.
Hi, Dr. Hinshaw. I'm just wondering if the province is considering extending the time between the first and second dose past 42 days, or does the province have enough supply of the Pfizer vaccine that it won't have to extend appointments past the original extension?
Our current intention is to have the interval between the first and second dose only go up to a maximum of 42 days. We're working very closely with Alberta Health Services, who are working on the scheduling of those second doses to make that happen. We don't unfortunately know yet how much vaccine we will be getting in 2 weeks' time. We do have our allocation for next week. And so while I can't say with certainty at this point, what I can say is that everything possible will be done to provide that second dose to all who've had the first dose within that 42-day period.
Operator, could you put through the next caller, please?
Bill Fortier, CTD.
Hi, Dr. Hinshaw. There was a coordinated effort today, primarily in rural Alberta. A number of restaurants opened up in clear public defiance of the restrictions. I'm wondering, this is a violation of a public health precaution or restriction. I'm wondering if you can tell me what will happen to those businesses and what happens if this grows and more businesses start doing this.
It is understandable that people are feeling frustrated with measures, and I know in some places in the province, people may not be seeing COVID cases in their particular area, but it is important to know that in all 3 of our rural zones, as well as our urban zones, we continue to see hospitalization putting pressure on the system in certain locations. And our healthcare system is a provincial one, and we need to think about that as an integrated system. I recognize again that these restrictions have been difficult for many business owners, and individuals who are choosing to move ahead in this way. What I would say is that these actions could potentially put at risk the sacrifices that we've made and this progress that we've made over the past couple of months, and that decisions that are being taken to open in contravention of the orders are not in the best interests of our communities, and that the frontline workers whose job it is to protect our communities and to ensure that the public health orders are in place will be having conversations with these individuals to remind them of the reasons why we need to stick to the measures and make sure that we are collectively preventing spread in our community, and of the potential penalties if people continue to choose to not follow those orders.
Operator, could you put through the next question, please?
David Staples, Edmonton Journal.
Hi, Dr. Hinshaw. My understanding with the vaccine rollout is that you want to vaccinate the most vulnerable people to COVID first. There's an ongoing concern from people who are either very vulnerable themselves to COVID, they're elderly with, let's say, Alzheimer's, but because they're in private care, they feel like they're being left out of the first vaccine rollout. Is it possible that in the first vaccine rollout, this 1A rollout, that you've missed a group of highly vulnerable people because they're in private care as opposed to public care?
We know that there are many Albertans who can benefit from the vaccine and many who are vulnerable to severe outcomes. That includes people who are living in their own homes as well as people who live in private accommodations. When we looked at the risks that we saw in the outbreaks that we've had over the past several months, and we looked at the risks of death, we chose to start with those locations where we saw the most significant risks of outbreaks and death. And we know that when we get the vaccine coming into the province to be able to move into that phase 1B, that we will be able to offer vaccine to those individuals who live in their own homes, who live in private care facilities, who are of that age group of over 75, or I should say 75 and over, who are the most vulnerable age group after, again, that group of long-term care residents. And so I recognize that there are people who will benefit from being able to access the vaccine. And as soon as we have that vaccine supply in the province, we will be making it available to those individuals as a part of that 1B rollout.
Operator, could you put through the next question, please?
Jesse Weisner, Global News.
Hi, Dr. Hinshaw. Thanks for taking my question. Advocates are asking to have people with Down syndrome prioritized for the vaccine rollout. Is that something that the province is looking at?
We're currently having discussions about what sequencing will look like in our second quarter in our phase 2, and considering the kinds of things that put people at risk for severe outcomes. No final decisions have yet been made, but of course we are looking not only at our own Alberta data, but also at published literature around what kinds of things put people at risk for those most severe outcomes.
Operator, could you please put through our next caller?
Julia Wong, Global News.
Hi, Dr. Hinshaw. A vaccination site on the south side of Edmonton posted a sign today saying no vaccinations today. We spoke to healthcare workers who arrived there only to find out then that they would not be getting their second dose today. How come there was no notification sent to them? The province had previously said it would honor second dose appointments. There is recognition that there are vaccine shortages right now, but healthcare workers tell us there's a feeling of lack of faith and they don't feel like their appointments will be honored. How do you respond to that?
I don't have the details about the specific local operations of vaccine clinics, so I'm not sure what exactly happened at that particular clinic. But what I would say is that healthcare workers who are showing up for their second dose, who are planning for that second dose and having their appointments shifted, moved, or in this case, if they show up for an appointment that unfortunately they weren't notified had to be moved or cancelled, I can only imagine would be incredibly frustrating. And I know that Alberta Health Services is doing their best to try and do the advanced planning to be able to give people notification. In some cases, perhaps that hasn't been possible. So I would just ask healthcare workers to be patient. I know that that's more and more difficult as, again, this vaccine shortage has forced us to change some of our plans. But unfortunately, we can only make plans with the vaccine that we currently have in the province and with the vaccine that we're expecting next week. And we do have to continually adjust those plans as, unfortunately, these numbers shift. So it will be challenging for the next few weeks as we work with these shifting numbers. I just ask healthcare workers to continue to work with those who are making those scheduling appointments and know that Alberta Health Services teams are doing their best to try to make things as smooth as possible, but unfortunately there are some hiccups based on these shifting vaccine supply issues.
Operator, can you put through the next question, please?
Matt Woodman, CTV Edmonton.
Hello, Matt, I believe you're on mute.
Hi, Dr. Hinshaw. Just a quick clarification. You mentioned the high for hospitals was December 30th. The high for ICUs, was that also December 30th, or was that a different date?
I would have to confirm. It was December 30th? Yeah, sorry, I don't have the dates in front of me, but we'll double check that and get back to you. I think it may have been on the same day, but we'll double check that and get back to you.
Operator, could you put through the next question, please?
Lauren Pullen, Global Calgary.
Dr. Hinshaw, I'm just looking for an update on where you guys are at in the investigation on tracking that one non-travel related case of the UK variant, and is it still only the one non-travel case that we have here in Alberta? And how much of an impact does that case and the new variants in general have on our current health measures and restrictions and delaying of reopening?
At the current time, we do just have that one non-travel case, again with some very limited household spread. And there's no indication at this point in time that there has been further onward spread. We haven't yet identified the source. We do continue to work on that investigation. At this point in time, the identification again of that case is something that is part of our need to be screening more samples to check to see if we do have more of these variant cases in the province. And I would say that the knowledge that this particular variant of concern has been showing up in some other provinces and other countries around the world as a part of community transmission is concerning, and it does need to be factored into our decisions about timing of reopening, because if we do enable more activities, more opportunities for people to be in close contact with one another, we could potentially see quicker spread if the variant is here in more locations than we currently are aware of, which is exactly why we're doing this additional testing, so that we have a better picture of what our current situation is in the province.
Operator, could you put through the next caller, please?
Kevin Berger, Town and Country Today.
Hi, I am basically posing a question that rose at a town council meeting yesterday. More or less, the town councilors were talking about the current restrictions and how they're sort of feeling that there's a feeling of frustration that there's no end in sight. Has there been any discussion about even just providing a target that we need to reach in terms of like lifting the restrictions? You know, as they termed it, a carrot for people, at least to know that at some point the end is in sight.
We are working on a framework that would help do exactly that, to help people be able to see what that target is that we need to collectively achieve in order to be able to open more activities. It's important to remember, and I know that it's easy to forget because there still are many things that are restricted, but it is important to remember that over the last several weeks we have reopened several activities. On January 11th, schools across the province went back in person, and just 10 days ago we did open up that option for in-person outdoor social gatherings up to 10, as well as all personal and wellness services. I know that for those whose businesses or activities that they enjoy are still currently restricted, that may not come as a lot of comfort, but it is important to remember that whenever we start to open up and open these activities, we do need to watch to see what, if any, impact that has on our community spread before we open up that next set of activities. And as I said, we are working on that framework to hopefully help people see those signposts and see how we are hoping to move forward, as long as we're able to continue minimizing transmission as we've been successful at over the past several weeks.
All right, we've got time for 3 more questions. Operator, could you put through the next caller, please?
Meredith Kerr, Lakeland Connect.
Hi, Dr. Hinshaw. Thanks so much for taking my question. So the question that I had for you was specifically to go back to the restaurants in rural Alberta that have opened up in contravention of the public health orders. I know that some of the patrons that they saw at some of those restaurants today were actually the part of the leadership of the town councils and of the county areas here, specifically the mayors and reeves, and they're saying that they're also there to advocate for being able to open up safely and saying that this can be done. So I guess I'm just kind of wondering what it is that you would say specifically to the leadership of those communities who are choosing to support those actions.
I would say that while it may be in one town or one county that a particular group of people haven't seen the impacts of COVID-19, we are continuing to see the impacts of COVID-19 in the acute care system coming from places in rural Alberta, and that I recognize how frustrating it is to have to wait on some of these activities, and particularly seeing the impact that they're having on businesses and on employment. And those have health impacts as well, and I recognize that. And yet, what I would say to those leaders is to think about not just what they see in front of them in their own town, but to look at the province and to recognize that every action that we take as individuals has repercussions and connections to our own communities and to the communities around us. And unfortunately, what we saw in the fall is that when we did take early targeted steps to try to minimize risk but not have businesses closed, we continued to see our cases climb, and we saw our healthcare system come very close to a tipping point. We want to avoid that, and we need to make sure that we are taking slow, measured steps. And I would ask them to hold on just a little bit longer to watch for the framework that's coming so that we have those targets in front of us and know what we're working to achieve to be able to safely start to reopen some of these activities in a staged way.
Operator, could you put through our second last question, please?
Dylan Short, Edmonton Journal.
Hi, Dr. Hinshaw. You spoke about the framework there. I was wondering, and you've mentioned that you're monitoring the system and everything that's going on with the numbers. I was hoping you could expand on that. What exactly are you looking at? What's the most important category, I guess? Is it that hospitalization number? We've seen it come down as well as the case numbers. So I guess, what exactly are you looking at when you're looking at the spread of COVID-19? And I guess when can we expect this framework to be released?
There's no single number that will capture all of the things that we need to monitor. So it's really important that we're monitoring both our leading indicators of our new cases, our positivity rate, and our RT value, that metric that tells us whether our cases are declining or growing and how quickly. And it's also important that we look at the impact on the acute care system, some of those lagging indicators like hospitalizations and ICU counts. And when we look at all of those things together as a package, it helps us get that full picture. One of the things that we need to make sure about is that our acute care system, as a primary goal of keeping that system sustained and able to manage care for all patients, that we're looking very closely at that metric of hospitalization and ICU as we're thinking about when we're able to open the different types of activities, because our primary goal, again, is saving that healthcare system. So we are looking at that. But we do have to also look at our new case counts and our positivity rates, because those are the things that will start to change first if we see that some of the activities that we've opened have caused increased transmission. So again, we have to look at that package, and more information will be coming soon.
Operator, could you put through our final question, please?
Thank you. The final question is from Sarah Comodin, Global News, Edmonton.
Hi. Thank you so much for taking my question. So to follow up on what my colleague asked a little bit earlier, we've spoken to other healthcare workers who were told their second doses of the vaccine should be rescheduled and that they would get a call to rebook. But they did not get a call when they were supposed to and had to make their own arrangements for their second dose. How come the province is not following up with healthcare workers in a timely way for their second doses? And if this is the system that will be rolled out to the general public, how do you assure Albertans that it will run smoothly and in a timely manner?
I, again, can't comment on the specific operational details in terms of how Alberta Health Services is managing the bookings of appointments. What I understand from my conversations with them is that because of the significant interruption in vaccine supply, that there were many people whose appointments did have to be rescheduled. Unfortunately, because we don't currently know how much vaccine we're going to be getting in 2 weeks' time, not all appointments can be rebooked until we have a better sense of that. So we do have to wait until we have the supply verified in terms of what we're planning for, and that could potentially mean that some healthcare workers who have had a second dose appointment had to be cancelled, that perhaps they haven't gotten that call back. What I would say about what this means for other Albertans is that we can expect that the system will have to adjust, and ideally, as we go forward, we won't see these kinds of significant interruptions in our supply, but we will have to ask Albertans to make adjustments along with us as we find out if there are shifting numbers or adjustments to the doses that we get. But the things that we're learning from this particular experience, of course, we will be applying into the processes that are used going forward so that we can minimize the disruption to Albertans as we move into the next phases of our vaccination program.
Thank you. Thank you all for joining us today. Dr. Hinshaw will provide another update tomorrow afternoon. Have a safe evening.